your knees. Can I help you with knee pain? And the answer is absolutely, maybe. There's a possibility that you may have what we call bone on bone in your knees, and the way to diagnose that is through an x-ray. Even if there is diminished joint space in the knee and you may not have bone on bone, then that's something that I can definitely help with. The thing with the knees is they're a complex, even though simple, joint, because you think of a wrist, it has many, many bones and many different articulating surfaces within the joint. The knee is a pretty simple joint because it's really two surfaces that glide with the kneecap and the side of the fibula. So it's not a horribly complex joint, but the key with knee treatment is looking at the joints above and below the knee. And that's why a lot of knee pain, the standard treatment for knee pain is not successful, because you really need to address all of the joints, specifically the joint above, which is the hip and the pelvis, and then the joint below, which is the ankle. If those joints are out of alignment, then the knee cannot track properly. I'm going to show you with a real live person on how this works. So you'll come step up onto the table here. The table will take you from standing to lying automatically. This specific table, the Activator table, is a great table because it preserves what we call the weight-bearing posture. How you're standing, you step up onto the table, and it's going to preserve the posture that you had as you were standing. And that way I can observe more easily your standing or your weight-bearing posture when you're lying face down. Table will take you from a standing position to a lying position automatically. The foot piece will fall away from your feet and the table will stop. And bend both knees for me and back down. Put the adjusting shoes on. And these shoes are important in the analysis because it creates a flat surface on the bottom of the feet so I can compare what we call leg lengths. And if a patient comes in and one of the legs is presenting shorter or longer than the other, it doesn't necessarily mean that that leg is shorter or longer. It just means that there is a tightening or a rotation in the body causing that side of the body to pull up compared to the other side. And that is one of the key factors in determining, is there a knee problem? With Activator chiropractic, one of the first things that we check on every single patient is knee alignment. And so if you've come in for any kind of treatment for me, whether it's low back, neck, or whatever it is, ankles and knees are always checked first. That is one of the primary joints that we check. Now, if we specifically just focus on the knee as a solo joint and try to treat it just specifically looking at it, we may be missing the causative factor of that knee pain, which can be coming from the ankle, the hip, the pelvic area, or the low back, or a combination of all of these. If, for example, there is a rotation in one of the hips, for example, if this right hip decided to rotate and it rotated what we called posterior inferior, it's going to lift that femur head, causing this leg to pull up compared to this leg. And what that causes is it causes you to walk on an uneven surface. I call it the weeble wobble walk. You kind of walk kind of like a weeble wobble. And that's because one of the legs is presenting shorter because, say, for example, if we're talking about the right hip, it's pulled up on the right, causing this leg to look shorter than this. It's not really shorter, it's just in a joint dysfunction within the joint. And if that rotation occurs, what's going to happen is the muscles on one side, the front side of the leg, are going to track differently than the muscles on the back side of the leg. So what's happening is there's an unequal pressure being exerted on the knee, which can cause faulty tractioning of these muscles, causing this knee to not track properly, causing resulting knee pain. And so what I do with Activator chiropractic is I look at the alignment of the pelvis area. Really, this area to this area is really, really important for treating knee pain. Once I've balanced out the joints as much as possible, Then I'm going to look at the supporting musculature. The supporting musculature through the glute muscles, the muscles on the front of the leg, the muscles on the side of on the back of the leg, the ligaments that go down. If there's an aberration in their function, that needs to be corrected to allow that knee to track properly. One of the great things about using Activator is I can specifically go in at different angles within the knee joint, whether it's the tibia, the femur, the fibula, the kneecap, which is the patella bone, and I can adjust those areas very specifically to allow a return of normal function in that knee. Then someone will get off the table and they'll say, my knee isn't feeling any better. One of the reasons is because it needs time to heal. Once it's set into place, there generally is a relief of pain, but that area needs to heal and restabilize. I did a video on why you would need multiple visits, and this is one of those situations. To address a joint problem, we call this an extremity joint, the knee, it may take, or usually does take, multiple visits and a multidisciplinary approach to treat that knee problem. Another common cause of knee pain is when someone is overweight or obese. And what happens with that, the extra weight on the body specifically affects the hips, then the knees, and then the feet. And that extra weight causes an internal rotation of the knees. It causes what we call a knock knee effect, causing a lot of dysfunction on the inside of the knees. And can chiropractic help that? No, but what we can do is we can make sure the supporting structures are in balance, and then that way that can allow some relief to occur within the knee joints. So can I help with knee pain? The answer is maybe. If there is not a dramatic loss of joint space, then yes, I can definitely help. Even if there is a dramatic loss of knee space and you are scheduled for surgery, and I've had multiple patients that have gone for knee replacement surgery, but they come to me ahead of time to make sure that their spine and the rest of the body is balanced. That way, when that knee, that replacement is done, whatever level of replacement is done, then it's done into a balanced body, not an imbalanced body. It's kind of like going to a tire place and you go to get your tire replaced. Well, what do? They take the tire off and they put a new tire on, but what do? They always realign the tire, the axle, before they put the tire back on or after they put the tire back on. The human body is a little different. It's always really important to get balanced out before that. So can chiropractic help without surgery? Absolutely. Can chiropractic help with surgery? Absolutely. So once the treatment is done, I've addressed the knees, the ankles, the pelvis, the low back. Then I will address whatever musculature is involved, and depending on the level of care that you choose, I may continue on and address the meridians. I may continue on and address the chakras and the auric field. And those are different services that I will talk about in different videos. But once I'm done with the basic adjustment, we'll go ahead and remove the shoes, bend both knees, and I'll get you back up. Depending on how long you've been down will depend on how many stops we make up along the way. So patient comes onto the table and it preserves what we call their weight-bearing posture. That's what's one of the magical tools within the Activator chiropractic technique, is we use a very specific tool and we use a very specific table to allow the best outcome for the treatment as possible. So if this patient has been down for 10 minutes, I'm going to allow one stop on the way up. If it's more than that, it can be 2 to 3 stops. We stop for a few seconds to allow the body time to get used to being in the upright position again, and then I'll bring the patient back up. Once the treatment is done, we'll discuss the findings and also what I've done during the treatment process.